Hello, my name is Dr. Rob Lindsey, and I'm a doctor of chiropractic at Vallejo Health and Wellness Center. And my question for you today is, has thyroid disease left you feeling hopeless? I'm going to talk to you about the 7 reasons why you continue to struggle with thyroid problems and what your doctor is doing wrong. The first reason is this: autoimmunity. And this is very often overlooked or mistreated. And this is very important to understand if you are to get better. See, everyone who comes to my office has the same 5 priorities, and here they are. Number 1 is autoimmunity. And number 2, blood sugar. Number 3, anemia. Number 4, gut and liver function problems. Number 5 is fatty acid metabolism. And autoimmunity is at the top of the list because it simply trumps everything else. When your own immune system goes out of control, it launches an attack on your own body tissues. And thyroid disease is often left off of the autoimmune diagnosis. Remember, diagnoses are labels, okay? Labels are for cans, not for people. Frankly, I seriously am glad that it's left off the list, because the medical world's answer for autoimmune conditions are steroids. And so if thyroid disease were on the list of autoimmune conditions, they would do even a worse job of managing it. A majority of the patients that I see with thyroid disease conditions have an underlying autoimmune disorder. And the immune system most commonly attacks the thyroid, which can cause blood sugar imbalance problems, your adrenal glands, which can cause chronic fatigue, and the nerves in your body, including causing numb feet or numb hands. So until we run the right tests to know that this is the problem, we cannot have all the information to get you better in the fastest way possible. So the second reason is this: it's all in your head. You know, how many of you have heard this? How many medical doctors have told you, or even alternative doctors have told you, it's all in your head? What this translates to is this: I don't know how to help you. Get out of my office. All of your lab tests are normal. All of the imaging you had is normal. I can't help you. And the thing is that your condition actually is in your head. The problem is that it's everywhere else too, okay? And your MD is only as good as the drugs he or she prescribes it. Please, I'm not bashing your MD. That's just the true reality. And see, there are many causes of thyroid disease, and one major cause is having a metabolic condition. And you simply cannot drug your way out of a metabolic condition. The third reason is that the wrong tests are ordered, and I see this every single day in my office. And we get somebody who comes in here and they've got stacks and stacks of blood work and other kinds of lab testing, and they've wasted thousands of dollars on them. And so these tests that they bring in usually have included with them complete blood count, a chemistry panel, and TSH, or thyroid stimulating hormone. Okay? They may have also ordered a group of autoimmune tests called HLA-B27. Well, why is that happening? Well, because these are what your insurance will pay for. But see, this is not enough information to actually get you better. See, we must look at what is going on inside of you, within you, much more efficiently. You know, did they run immune panels? Did they run an adrenal stress index? How about a food sensitivity panel or a stool microbial test? We need all of these tests in order to make sound clinical judgment. The fourth reason is that the right tests are ordered, but you got the wrong results. Now, medical doctors use lab reference ranges as a guide to determine whether or not you have a particular disease. And these lab reference ranges are inherently very inaccurate. They're based on tests of unhealthy people, and they're a very broad range. So functional ranges, on the other hand, are based on optimal levels, okay, of healthy people. So doesn't it make more sense to look at what health is, or what healthy is, rather than to look at what sick looks like? Do you want to be compared to sick people or health people when they're determining your lab results? So let's look at this. The easiest lab reference range to use, for an example, is TSH, or thyroid stimulating hormone. And this is what is used to determine whether or not you have a thyroid condition. And traditional medicine uses a very broad range from 0.5 to 5.5. In other words, if your TSH level is below 0.5, you have hyperthyroidism, and if it's above 5.6, you have hypothyroidism. However, in order to have maximum thyroid function, your level must be between 1.8 and 3.0. So as you can see, this is a much more narrow range. You can be completely hypothyroid with a lab value of 3.5, yet your doctor says it's a normal test. So we use functional lab ranges, not traditional lab ranges. The fifth reason is this: drugs, drugs, and more drugs. Thyroid disease is caused by a breakdown in your metabolism. It's a metabolic condition, and you simply cannot drug your way out of a metabolic condition. Now, for about 10% of the population, for thyroid people, the people who have thyroid disease, drugs will help, okay? But for the other 90%, taking drugs like Synthroid over a longer period of time, they'll actually make your thyroid work less and less efficiently. So the question is, do you really want to continue to gamble with drugs and their side effects, both known and unknown? I don't. And the sixth reason is this: they had no dietary changes. And see, most doctors don't know much about nutrition. How do I know this? Just recently I was at a seminar. I sat at a table with a functional medicine, a pediatric functional medicine doctor, an MD, and an adult functional medicine MD. And they both told me that they had about 3 minutes of nutrition in their coursework in medical school. And they said jokingly that about half of that was the instructor introducing themselves. But they said, in all seriousness, they just don't learn much about nutrition. So if you go to your MD and ask him or her about gluten, for example, they'll run a celiac test on you, which is a very inaccurate test, and then they're going to say, okay, well, you don't have celiac disease, so go ahead and eat whatever you want. The fact is that your condition is quite frequently being caused by what you put in your mouth, okay? And the standard American diet, what we call the SAD diet, is actually causing so much stress on your body that it's making you sick. Now the seventh reason is that you're taking too many supplements. That's true. Taking too many supplements can actually make your condition worse. That is a fact. So if your thyroid problem is caused by an autoimmune condition, okay, where your own body, your immune system is being attacked, all right, making you sick, then taking supplements can actually trigger an autoimmune reaction and make your condition worse. Here's the good news though, there really is hope. You can be helped. And I really don't care what other health professionals have told you. Your thyroid problem can be helped without the use of drugs. So if you were to come to our office, and if I were to accept you as a patient, you're going to get results. We see it over and over, day in and day out. We're getting results with people. So, in closing, I really hope that you found this information eye-opening and that it gave you some hope, and I hope that you would call us. Again, my name is Dr. Rob Lindsey. 952-949-0676 is our number. Please don't waste another second. Okay? Call our office now for a complete neurologic and metabolic workup to see how we can change your life. Thank you. Have a great day.